Flaker. I'm a professor of medicine at the Department of Medicine at the University of Missouri, Columbia. This analysis looks at patients who have three different types of atrial fibrillation: paroxysmal, persistent, or permanent atrial fibrillation. And we're interested in determining whether or not the favorable results with dabigatran are consistent in those patients with the three types of atrial fibrillation. Consistent with the main study result, when we look at dabigatran at 150 milligrams twice a day compared to warfarin, the main trial told us that that medicine, dabigatran, was superior to Coumadin. And when we look at paroxysmal atrial fib, persistent atrial fib, and permanent atrial fibrillation, we get those results. This is consistent with the main study results. Now, we also knew that for major bleeding at 150 milligrams, the main trial said that this drug was about the same in terms of major bleeding. And sure enough, the risk of major bleeding for the three types of atrial fibrillation were near the line of unity, consistent with the main study results. The surprise thing on this study was the response at 110 milligrams twice a day. We knew, looking down here at major bleeding, that the risk of major bleeding would be less in the main trial, and all of these estimates are to the left of the line of unity for paroxysmal, persistent, or permanent atrial fibrillation. However, this is what has us confused at the moment, is that there does seem to be a different response to the 110 milligram twice a day, with people with paroxysmal atrial fibrillation clearly responding much better to this, with a tendency for patients with permanent atrial fibrillation to respond less well. This is a little bit confusing to us because biologically it doesn't make sense, and this was not a planned, an expected finding. This interaction p-value suggests that there might be something to this, or it may simply be a play of chance. And that's what's going on with further analysis when we're looking at this before we submit this manuscript for publication.